All right, Deepti Gurdasani is a UK-based epidemiologist. I think you're in Cambridge right now, Deepti.
That's right.
Tell me, is the government lying or suppressing information on the statistics and data on children and COVID in schools?
It does appear so. So there are reports from The Observer, which is a newspaper here, which suggests that on the 13th of May, data on schools and the new variant, the so-called Indian variant or the Delta variant, were due to be released, but that data was withheld at the behest of our government on number 10, which is really, really concerning. These data essentially have been requested for several weeks now from unions, from scientists, even from MPs who put in questions and not received any response. And the reason that we've been so keen to understand this and get this data is that on the 17th of May, the government, without providing a lot of explanation, removed recommendations for masks in schools. We have very few mitigations in schools here in the UK. Often children go into schools with large classes of up to 30 children. We have bubbles that go up to hundreds of people in size. We have little access to ventilation apart from open windows and doors, and not all classrooms have those. We don't have masks now in primary or secondary schools. And that's really concerning because all of this is out with CDC recommendations. And we as scientists have been trying to understand on what basis the government has made these decisions and asking for the data, particularly with the spread of the new so-called Indian variant, which we know is happening among children. We are very concerned about this, but the data are not being released, despite now a pre-action letter being put in by a group which is due for response by tomorrow. I don't believe that they've received a response yet.
So this data normally by the British government is released and then suddenly wasn't released. What do you think it's going to tell us?
Well, I mean, it's not, I guess, normally released because we normally don't have necessarily new variants in the UK. So it was specifically asked, we know this data exists because the Observer did a piece and they've seen the page that wasn't released. And we know that obviously the data existed but wasn't released. I think we're all very worried that what we're going to find is that there is a lot of spread of this new variant in schools. And we're already seeing signs of that. For example, we know that in places where this variant is dominant, the cases in school-age children, particularly secondary schools, have been 3 times as high as other unvaccinated young adults, like 20 to 24-year-olds. And this is a consistent pattern across places where this variant is dominant. And we've then seen spread from these age groups into other age groups in the community, suggesting that schools are actually not just contributing to transmission, but really driving the spread of this new variant across the population.
And in fact, some people have said that some of the higher levels of COVID now in 30 to 40-year-olds, which traditionally, statistically would be the parenting group, that they are much higher.
Absolutely. And we see that sort of double dip pattern where you see high infection rates in children and then what we consider the parental age group prior to spread into the other age groups, which is quite consistent with whatever we've seen whenever schools have been opening. Infection rates have skyrocketed up among children. And of course, we hear news reports of numerous schools with large outbreaks, schools having to close, bubbles having to close, but we don't have any systematic data on this, which we urgently need to understand what policies should be in place to prevent this highly transmissible variant spreading.
It's just the last thing you would expect the government to do is to hide data. I mean, they're supposed to be working with scientists all over, just not on their advisory committees, but scientists all over the world and all over the country to understand where they're headed with these variants and why suppress data. It's like, because why? The government policy to open for the summer and to allow travel, they're alarmed that this data will spin some of that backwards? Or?
So it's very hard to say. I mean, the independence of a public health agency, and Public Health England in the UK is like, in England is like, let's say CDC in the US, you know, the independence of a public health agency like that in the middle of a pandemic is paramount. And the transparency with the public is absolutely essential for public trust and to hold government policy to account. I think the narrative from our government, at least, has been that they've always followed the evidence, followed the data and not dates. Rather, you know, not follow this sort of a series of easing steps in lockdown that they actually laid down in February. Unfortunately, that doesn't really appear to be the case because the data has strongly argued or cautioned against, as have the government's own scientific advisors, against the sort of opening up plan that the government is following, as well as the dropping of mitigations in schools. So I think part of this is sort of meant to, I guess, justify policy that's not based in evidence. And I think government is possibly worried that they might be challenged if this data does come out, and it might really question the steps they've taken, because they were clearly aware of this data weeks ago.
Are you being alarmist? Because President Biden has said it should be a summer of freedom. The UK government is, slowly putting countries on their green travel zones where you don't require quarantine when you come back from those countries. They're saying that generally rates are falling. People are getting vaccinated. Why shouldn't we be opening up and relaxing?
Sure. So let's look at it objectively. We have a new variant in this country that we know from our own data is showing that it might be 60 to 70% more transmissible than our previous variant, which was already 60% more transmissible than the previous variant. That's highly transmissible. We know that this variant has caused devastation in India and is continuing to cause devastation in places like Bangladesh, Pakistan, Nepal. We also know that it's a variant that's become dominant in the UK. It's gone from almost not being present at the end of March to being our dominant variant in a matter of weeks. It's been doubling week on week amid restrictions. So prior to all the easing steps, it was doubling week on week while our other variant was dropping. That's a highly fit variant. We also know that it has a high level of escape against vaccines. So for example, a single dose of vaccine, which is what much of our population had because we adopted this policy of increased gaps in vaccines, provides only about 30% protection against symptomatic disease. And you need 2 doses to have a much higher level of protection. And this variant obviously is a major risk to public health response, even with the current level of vaccination, because only about 39% of our population is fully vaccinated. That leaves 60% of our population either with 1 dose or completely unvaccinated. And our own scientific advisors have essentially said that with the current level of vaccination, with a highly transmissible variant that has a level of escape against vaccines, we are due to reach a level of hospitalizations at or above our second wave, which was devastating. So it's not alarmist at all, because our own scientific advisors have done modeling that shows that such a variant could cause devastation despite the fact that 40% of our population is fully vaccinated. So we do have to listen to that.
Do you think that we are in the initial steps of that wave?
There's no doubt about that. We're seeing exponential rises in England and Scotland. Scotland is a bit ahead of England. And worryingly, those rises are also being accompanied by a rise in hospitalizations. So, that link between cases and hospitalizations that we hope, is weakened by vaccination. It almost certainly will be weakened by vaccination. It's not been broken. And we're still seeing rise in hospitalizations as cases rise. And that is a sign of what is to come. And, we have our hospitals.
This is so confusing. I don't mean to interrupt, but it's really confusing, right? And that's one of the reasons I wanted to talk to you. And I know you and other epidemiologists who are conservative in your approach to opening up and feel that the government shouldn't be putting the economy before health concerns, that you have to balance the two. But I mean, saying you're going to balance something is a convenient way sometimes of compromising on the health side. But
well, first of all, I don't believe the balance thing at all, because I think our economy is inextricably linked with public health. And if you don't control the pandemic, your economy will suffer, because I feel like if you're not cautious now, we're heading towards another lockdown, which would have a huge impact on the economy and on public health. So I think the best way to protect public health, economy, is also to protect public health. So I don't see those two things as different at all.
But most people now have been listening to the government. They've gotten their first vaccine. They're probably going to get their second vaccine in a few weeks. In the UK and the US, a lot of them have it. Unfortunately, many countries aren't even in that position. But they think, okay, we can start going to restaurants again. We can start going to the gym again. We can start jumping on airplanes and going out for the sun, spending a couple of weeks outside the country. And you're telling me that you think you wouldn't do any of that?
No, I mean, this is a highly transmissible variant. We just need to listen to stories from across the country. I mean, see what's happening in Vietnam. They've had 0 cases for a long period of time, and their pandemic has lost control because these cases have spread to the community before their test trace system could keep up with it because it spread so rapidly. We're hearing reports from Australia that, people are getting infected 2 hours after entering a room that somebody else was in. That's an aerosol transmitted, highly infectious variant. And this is the sort of variant that can rapidly get out of control. I mean, we saw this happen in India. We've seen this happen in different countries. We have global evidence. So allowing such a variant to become dominant across the globe, which is where we are headed now, because that's what happened with the so-called Kent variant, would be hugely irresponsible. I mean, this is not a variant we should learn to live with. It's a variant that we need to stamp out because, as you say, many countries don't have massive levels of vaccination, and even countries who do, first dose doesn't protect you to the extent that you need with these variants. So we need to, I mean, for me, this really highlights we need to pivot to elimination strategies. And it's not just about this variant. I mean, each variant that we see, is fitter than the previous one, outcompetes the previous one, and brings us closer to vaccine escape. I mean, I'm very, very glad that this doesn't fully escape vaccines and that 2 doses are still highly effective. But what if another variant comes in that doesn't have that? What happens to pandemic response
Is
in
that
countries?
is that inevitable, do you think, if we keep doing this yo-yo seesaw, open close, half close, half open? Do you think it's inevitable that we reach this point, even with all the vaccinations, that's it? We have a variant suddenly that's identified that the vaccines are not going to work against, and do they just go back to the lab and come up with a new vaccine like that, or is it much more complicated?
So I don't know about inevitable, but it's highly likely. And I don't think it's just a hypothetical because we know there are variants that exist now that with very high levels of escape against vaccines. The so-called beta variant or the so-called South Africa variant is one of those. And there's very good data from University of Cambridge that shows the best conditions for the virus to adapt towards escape is when you allow high transmission with vaccination of the vulnerable predominantly, because then what you have is high levels of transmission among populations that mix that are not as vaccinated. The virus spreads and comes into contact with this wall of immunity or selection pressure, and variants that are more likely to escape become selected. So that combination of transmission and selection pressure creates a fertile ground for that sort of escape. And we're just going to start seeing that now as more and more countries have a high level of vaccination. We haven't had that level of selection pressure in the population yet. So we really haven't seen the entire breadth of the mutational landscape of this virus. And it's very, very likely that we're going to get more escape mutants that are more likely to escape. And the problem is our entire strategy has been based on vaccination. So much resource has been put into vaccination. And yes, people say we can update vaccines, but how are you going to keep up with virus evolution? I mean, we've heard recently that AstraZeneca is in the process of developing a vaccine that works against the so-called South Africa variant that our government in the UK is now ordering. But that's not a dominant variant anymore. In fact, it's been outcompeted completely by the Delta variant. Now we need vaccines that work against the Delta variant. And by the time they come into place and we vaccinate a substantial number of people with them, there will be another variant. And this virus is not mutating to become flu, like some people say. It's mutating at every step to become more transmissible, possibly more fatal. We don't know that about the Delta variant yet, but certainly the Kent variant did, and towards more escape. And unless we exercise our agency to prevent that, we can't expect the virus to stop adapting. And the only way to prevent that is to stop transmission.
Deepti Gurdasani, it's always great to talk to you. Thank you so much.
Thanks for having me.